Welcome to SheTV.com, where board-certified physicians talk to you about women's health. In this episode, Dr. Anu Bajaj, a board-certified plastic surgeon, talks to us about fillers and Botox, as well as the importance of selecting properly trained providers to do your injections.
Hi, I am Connie Franklin, and I am here with Dr. Anu Bajaj. She is a board-certified plastic surgeon, and we're going to talk about toxins and fillers. With a med spa in every corner, what do people need to consider on if they should, head to this med spa? They have $8 per unit Botox, or my other option is I go to a plastic surgeon, a board-certified plastic surgeon. And what is the difference? What makes the decision, what's the decision process for people?
So I think it's really important for people to understand that even though toxins and fillers are done for beauty and to make us feel better, there are still risks associated with them. And so you don't want just anybody poking needles into your face, to be honest. Granted, the risks for toxins are less critical for the most part, since most of the toxins don't last past 3 to 6 months. And so in that situation, if you were to have a complication, most commonly it's like a droopy eyelid, some brow asymmetry, maybe a droopy lip, or things like that. And while those are a nuisance, the good thing is at least they're temporary.
So that once that wears off, then the risk of whatever happened is probably going to fix itself.
Exactly. Now, with fillers, the risks are higher. There's lots of concerns about intravascular injury. And what that means is that when the filler's injected, it gets into the blood vessels. And so in that situation, you can have tissue necrosis. In other words, the skin turns black and dies. And I have seen this at times when not my own patients, but other patients who have had injections elsewhere have had injections to their nasolabial folds, also known as your parentheses lines, and filler gets inadvertently injected into a vessel, and that tissue will necrose and die, and then you need formal reconstructive surgery. Other situations that I've seen is was consulted once on a woman who had some discoloration after injection along her jawline because there was an intravascular injury. There have also been reports of blindness after a filler injection, and this is most common when we do fillers around the eyes or in that area right here. Skin necrosis is also very common for non-surgical rhinoplasties, which is a filler in your nose, and that's because, once again, of the vessels and the pressure on the tissues. So because of those risks, I would encourage any patient who is considering an injectable to fully assess the qualifications of their injector. And one thing I think is important that we forget is that anybody who is performing a procedure should also be well versed in the management of the complications of those procedures. Not only well versed in how to manage them, but also knowledgeable about the resources necessary and who to call when something happens that's bad. I think the advantage of going to a board-certified physician in a core specialty, and what I mean by the core aesthetic specialties, I'm talking dermatologists, facial plastic surgeons, all of those individuals are in the practice in their scope in the core of aesthetics. And they have a knowledge of the anatomy at a deeper level than somebody who has taken a weekend course on how to inject fillers. And I think that's the critical difference.
So what is your understanding and what are some of your experience and qualifications that you have under your belt, in your tool belt?
So as a board-certified plastic surgeon, obviously I've done a general surgery residency for 3 years, I've done a plastic surgery residency, and I've done a fellowship. But most importantly, I also believe I have a full understanding of the anatomy. I've done reconstruction after facial fractures, I've done reconstruction after cancer, and I've done aesthetic surgery, including facelifts and so on. And so when you do surgeries, you start to understand that the face is a three-dimensional structure, right? We've got skin, we've got some subcutaneous fat, we've got our superficial muscle layer, then we have our muscles of facial movement, and we have nerves and blood vessels, and we have a three-dimensional understanding of how all of those play a role. someone who has not necessarily been exposed to all that or may not have a feel for the three-dimensional nature of your body. And I think that's an important distinction on how you do all of these aesthetic procedures.
I love how you described that too, because I think it can apply to almost anything. I have a general understanding of how my car works, but once I start opening the hood and like messing around in there, I don't really understand all that. So I have more of a superficial, I know I can, how to start the ignition and press on the gas and go. But if you've spent a lot of years in training and gaining knowledge on something, you have just so much more of an understanding. I think that applies to everything. So I thought that was a really well-rounded response on that.
I think it's a great analogy, what you just brought up, because it's
thank
true.
I was like, oh, I can go so many ways with this. But I'm also just wondering, people get worried about doing fillers, and there's even a filter on Instagram or TikTok or Snapchat, pillow face, right? Where you can see, I would like to see what I would look like with filler. So I go put pillow face on and, oh, okay, so now here's my Botox is going to give me Spock eyes, and my lips are going to be out to here. And if I look at that filter, I go, oh, that's not what I want to look like. So I guess I better not do anything.
So what I would say is when filler and toxins are done well, you have no idea that they've had it done. And I think that's critical. I think when you can tell that people have had those procedures done, then it hasn't been done well. And that might be another thing that you consider as you consider who's going to do your injectables. And I'm going to be honest, I have been doing toxins and fillers on my face since I was 30, and I'm 55 now. So I think I actually look pretty good, and I don't look like pillow face, and I don't look fake. So I'm hoping I have a good outcome. But
I also think that it's when you know your surgeon or your injector, if their aesthetic matches yours, right? So if I do go to an injector who is overfilled, over injected, maybe maybe we're a good match. Maybe we're a good fit because that's the look I was going for anyway. And I do believe some people are really going for that. Or they get used to how much filler they have in their face, right? And then they think, oh, it's all gone. Which that brings up another topic is how long do fillers last, and are they actually temporary, do you think?
So theoretically, for most of the fillers, they all have FDA approval for lasting a certain amount of time, which is anywhere from 6 months to a year to 2 years or so on. Sculptra is the only one that's supposed to be more long-term, of about 3 years, and that's more of a regenerator for collagen and a collagen stimulator, if you will. A lot of the fillers, particularly the ones around our mouth and our lips, I don't believe last as long, no matter what we use. And that's primarily because we move our lips around a lot, and they get metabolized. When you do filler on a deeper level, like in the tear troughs or on the bone, then it tends to last much longer. And so fillers have a varying degree of how long they last.
So if you had a chart, if you made a chart and you said, here's the lip, the cheek, the eye, these areas, and I just followed a little calendar and came back every, 6 months for my lips and every 18 months for my tear troughs and every, followed this. Is that something you suggest, or how?
I would. So that's a little bit tricky because I don't want to get into the situation where we're just doing filler because it's that time when you don't need it. I think it's really important to do a critical assessment. In my heart of hearts, I actually think that fillers have a long-term effect in stimulating collagen, and there have been rat studies to suggest that, but we don't know that for humans. But as a personal example, I can say that, I'm 55. I've been doing fillers since I was in my 40s. And initially I may have done a lot, but over the years I've noticed that I taper off on my needs. Like I did some filler, or had one of my friends do some injections on me recently for the first time in 2 years. And I hadn't really felt a need for it until then.
Which is interesting because as we age, you would think you would need more filler.
Exactly, because we lose all the volume in our face because it's that cruel joke. As we get older and hit menopause, we gain weight everywhere else and can't lose it, but we lose the volume of our facial fat compartments, which is why fillers do play a role in facial rejuvenation when they're done correctly.
So when we're talking about fillers and toxins and med spas, I would think that there's always going to be people who are drawn to those because they are value driven. Whereas other people's, like you said, you want to know who's sticking needles in your face. Have you seen and I think we've looked at the numbers as to the population wide or how many people are getting more over the years. It's more and more and more. And I think you could walk in any room and more women are talking about it as well, where it used to be more secretive, right? Or
Right.
we would be watching these celebrities and we would think, oh, they're just aging so gracefully.
Hmm.
Are they aging gracefully? Are they?
Well, if you're aging gracefully, no one knows you're aging, right?
Exactly. Yeah. Yeah. And how does this apply to um, coupling with facelifts?
So if you've been doing toxins and fillers for a long time, that doesn't mean that you may not need or want a facelift in the future. I think toxins and fillers fall into the category of more maintenance. A surgical facelift is going to do very concrete things, and that's to remove the excess skin, tighten the underlying muscle layer. And so a lot of times those are complementary to toxins and fillers. And in fact, a lot of times with facelifts, we'll do fat grafting. So we're going to use your own fat instead of a filler to restore some of the volume that you've lost. So just so it's not an either or. Ultimately, it's probably a complementary process.
What that brings me to a question. What are the limitations with fat transfer and fat grafting? Because wouldn't it be just lovely? I think I've made this joke almost my whole life. You know, if someone has more here and less there, like let's just move it. And don't we wish that that could just be the way it is? But the reality is there's a limitation to fat transfer.
So when we're injecting fat, no matter where it is, whether it's your face, your breast, your buttocks, those are probably the three most common areas that we're injecting fat to in today's world. We're injecting the fat and relying on it to get a blood supply from the surrounding tissue, which means you want to inject it in thin layers and allow it to get a blood supply so it can be healthy, survivable fat. Which means that not all the fat that gets injected will take. Only about 50 to 70% will take, and by take, I mean get a blood supply and survive. So if you over-inject, it's not really going to do you any good, and it can actually lead to complications down the road. And so that's what I try to explain to patients is that there's a limitation. That's why it's fantastic for the face because we're only doing small volumes typically. I don't necessarily think that fat transfer for the breast is ideal because it's not going to give you a huge volume increase. And also with the breast, if you were to overinject, you can get oil cysts and calcifications, which may affect your imaging in the future. So you don't really want to overinject.
How much can you inject for a breast?
So the way I approach injecting for a breast is I look at the surface area of the breast and I want to inject in that plane between the skin and the breast tissue, so in the subcutaneous fatty plane. So that means if the breast surface area of the breast is about the size of my hand, that surface area is probably going to be 150, maybe 200 cc's. So that's not a huge volume increase.
Right. And then only half of that's going to probably
Exactly.
survive. 50 to 70% of it survives. And you already explained, but I think that would be the first question is if only 50 to 70% is going to survive, then just go ahead and double up on it.
Well, you can't.
But you
and
can't.
And I've actually seen that happen where I had a patient where whoever did her surgery just injected lots of fat, like just globs of fat. And then she had these huge knots that had to be removed because they were all fat cysts. It was the weirdest thing, but it felt hard and it disfigured her breast.
Oh, that's unfortunate because the whole point of a cosmetic surgery is to enhance your look.
Exactly.
Right? And that's not the goal. Like your goal is to look better, not worse.
Exactly.
Which I think leads us to right back where we always start is make sure you know who you're going to. Board certified plastic surgeon, board certified. What does it mean when somebody says they're double board certified, triple board certified? You know what? That sounds better. I think I'm going to go to somebody who's triple board certified.
So I think it's important for people to understand that just because you're certified by 2 boards, 3 boards, 4 boards doesn't necessarily mean you're better qualified. What you have to look for is what board the physician that you're going to is certified in. For example, if I'm certified in plastic surgery as a board certified plastic surgeon, that is my scope of practice. But you wouldn't come to me if you needed neurosurgery, because I'm not board certified in brain surgery, right? So that would be silly. But the thing is what we see very common in the aesthetic world is people want to say that they're double, triple, quadruple board certified, but many times the certifications that they're adding on are completely unrelated to aesthetic surgery. Some of them may say that they're triple or double board certified and they're an OBGYN, or they're an emergency medicine physician, or they're a dentist. Yeah, those are all certifying boards, but those have little to do to improve their qualifications in aesthetic surgery.
So more is not always better.
Right.
And especially if it's irrelevant to what we actually need. How many plastic surgery board certifications can one person have?
So the American Board of Plastic Surgery is the only board that's recognized by the American Board of Medical Specialties. So that's the only board by ABMS. Obviously, dermatologists are also recognized by ABMS as our facial plastic surgeons. So those are, I think, the primary three board certifications in aesthetic surgeries, or in the aesthetic specialty world, I would say.
And then going back to...
And oculoplastics. Sorry, I can't forget the oculoplastics because they're also board certified.
And then you'll go home tonight and you'll be falling asleep and you're like, oh, I forgot another thing. Like, that's always comes to me. I'm like, wait, can we go back and do this? The things that that slip our minds. Going back to injectables and fillers, were there any other things that you wanted to add to that topic?
So I think it's important that as you research where you're going to choose to have your injectables, not only do you understand risks and complications and know who your injector is and feel confident in their aesthetic as well as their ability to achieve your goals, that you research it and ensure that they're following appropriate guidelines. You know, sometimes not all of, like, I don't necessarily think I would go get my injectable at my hair salon. Just say.
But what's funny is, have you seen a trend in areas that are starting to add on? All of a sudden, I'm like, wait, I wouldn't be surprised if hair salons were doing
I think they
Botox
are
right
in
now.
some places. I think they are in some places, to be honest. And I also have heard of estheticians doing injectables, which to me is odd because I really thought you had to have some sort of a medical license, whether it be a nursing license or an MD, to do injectables. So I don't understand that. The other thing I would caution people about are like the so-called Botox parties or whatnot that were really popular, where you go party and you have drinks and somebody does your injectables. I don't think that's safe either. And in fact, several years ago, the American Board of Plastic Surgery came out and said that you can't do injectables if you're also serving alcohol, because you can't get informed consent from somebody who has consumed alcoholic beverages. So that makes logical sense, right?
That does make logical sense. And I think we all know scientifically what alcohol does to even like your blood. You're gonna
bleed more.
They say like you can't get a tattoo if you've been drinking, or well, I guess you can in some.
But
places.
you're not supposed to.
You're not supposed to.
Well, it was interesting. Several years ago, I had a patient who was at a Botox party, got injected, and guess what? And she got injected by a non-core person. So I don't know who did the injectable, but it wasn't a board-certified physician. Fell and cut her lip. And then they had to call me to do the laceration repair. I thought that was very ironic.
That is ironic. Oh, that's funny. But it is like you have certain things that you would recommend to patients who are coming in for Botox and filler, tox and filler. Botox isn't the only one anymore. We have lots of options now. But there are certain things that you can do to help make your recovery a little bit, because, filler can be a little traumatic to your face. You're injecting this, so you're going to have swelling, and you might even have some bruising. And what are the certain things that you could do ahead of time, or that patients can do before, during, and after to reduce those?
So one of the things to remember, as you said, that some of the short-term issues with fillers is you can have bruising and swelling. So, one thing you want to do to minimize bruising and bleeding is you probably want to limit or stop doing aspirin or any type of anti inflammatory beforehand, probably 5 to 7 days before. You can also, before your appointment, take 2 Tylenol and a Zyrtec to help decrease the pain and discomfort as well as the swelling. And then after your procedure, you're going to want to do icing and take it easy for the rest of that day, and maybe take another Zyrtec that night to decrease swelling and any reaction you may have. And I think those are important things to think about also.
What other activities should we just definitely keep off of our list for after injection and after an injectable?
So the recommendation after any toxin injection is that you basically avoid lying down for about 3 to 4 hours, and you avoid working out for the rest of the day. Usually it's 24 hours, just to decrease the risk of any of that toxin spreading.
Do you personally subscribe to that?
I am not always a rule follower.
They always say that physicians make doctors are the worst patients.
I would agree.
So sometimes I just think it's sometimes fun to pull the curtain back and say, okay, and tell me you've never worked out after an injection.
But
and then is there a difference when you said no lying down? Is there a difference of lying down this way, that way, each way, and what does that do to your injection?
The theory is that it increases the risk of the toxin spreading, whether it's real or not. I mean, I'm going to be honest. Personally, I have not seen it, but it's the recommendation that everybody gives.
Right. And we're gonna read the fine print, and then we're gonna make an informed decision. And
Exactly.
if we decide that lying down is just worth it, worth whatever those risks are, then sometimes you just don't follow the rules.
Not all of us are rule followers on everything.
On everything.
Right. we follow the rules on the things that matter, and I think that's important to think about.
Yeah, I think so too. And like you said, and knowing the risks. Okay, if I'm not going to follow this rule and the risk is like super severe, that one's worth following.
Exactly.
Yeah. Well, thank you so much for going over that with us. I think we've learned a lot about injectables and where to get them and what guidelines to follow and to make our own personal informed decision.
Thank you.
If you wish to contact Dr. Bajaj, her office phone number is 405-810-8448 or visit her website, bajajplasticsurgery.com. Thank you for watching SheTV.com, where board-certified physicians talk to you about women's health.